Ladies and gentlemen, our next session is very, very interesting. We're going to talk about nutraceuticals for cardiometabolic health management. I'm going to call our moderator on stage. They say that a leader is the one who knows the way, who shows the way. But we have one such leader with us who knows the way, who shows the way, and always walks the way with us. So please help me in welcoming our moderator for the session, Mr. Rohit Shelatkar, Director at Vitabiotics and Nutrition Expert. Very warm welcome, sir. And joining him, we have our speaker, Dr. Nitin Patankar, esteemed cardiometabolic physician. Let's have a huge round of applause for him as well. Over to you, Rohit, sir.
So, good evening, and first of all, let me thank Vitabiotics for giving this opportunity to come here and speak on cardiometabolic health and nutrition. I remember when I was doing my MBBS and MD, that time we had nutrition as our curriculum for 4 marks. So when I started practice as a diabetes and obesity specialist, we had to give a lot of focus on nutrition, and that resulted in a big dilemma. My physician friends started calling me nutritionist, and a nutritionist never accepted me as a dietitian. They always say he's a doctor, he doesn't know anything about nutrition, because they had only 4 marks for nutrition. So luckily, over the last 20 years, the scenario has changed, and now we are talking about metabolic medicine, where the nutrition is used as a therapy. Till that time, nutrition was an adjunct prescription. So this is basically the topic, nutraceuticals for cardiometabolic health management, enhancing patient outcomes with nutraceuticals and supplements. So what is the definition? The nutraceuticals are basically foods, derived products that provide health benefits beyond its nutritional values like carbohydrate, protein, fats, and minerals. It has got something more than that. Then there is an increasing interest in the preventive health care and managing chronic diseases through nutraceuticals. Because if you look at the industry, pharmaceutical industry, we have seen that the advent of antibiotics have stopped. More focus is given on oncology, and even the cardiology has become a standstill. So now people are looking at nutraceuticals to treat diseases rather than giving as only supplements. And nutraceutical encompasses a wide range of functional foods and dietary supplements. So what is cardiometabolic health overview? So cardiometabolic health involves the interplay between cardiovascular and metabolic diseases, include conditions like hypertension, diabetes, dyslipidemia, and obesity, and impact of these conditions significantly affect global health and quality of life. Nowadays in our consultation, if some person comes and while taking a history, the person tells me that he doesn't have diabetes, he doesn't have hypertension, he doesn't have lipid disorders, he doesn't have hypothyroidism, then usually we say he's a very unique person. Because very rarely we find anybody reporting the OPD who doesn't have any of these conditions. So pathophysiology of cardiometabolic diseases. So once we remember these 2 words, because a lot of things are talked about cardiac pathology, diabetes pathology, the octate and pentate, everything was talked about. But basically it boils down to inflammation, which is low-grade generalized inflammation, oxidative stress, insulin resistance, and the progressive disease that is not curable. So we require something which is for lifetime. Though there are a lot of things that are coming up like reversal of diabetes, remission of diabetes, but still all these diseases are chronic lifestyle diseases which are continuously progressive. So role of nutraceuticals in cardiometabolic health, basically as I said, anti-inflammatory effects of foods or nutraceuticals, antioxidant properties, insulin sensitizers, and we have to have clinical evidence. Now the biggest problem in nutraceutical industry is that we cannot have hard endpoints. Because in medical field, there is a placebo, there is a people who are not taking the drug at all, and people who are taking the drugs. So all the what you can say, bosses in medicine, they always ask anybody who talks about nutraceuticals, where is the evidence? So I remember Dr. B.M. Hegde, he used to say that the medical field has, rather than becoming evidence-based, it has become evidence-burdened medicine. So for nutraceuticals, basically it's a population studies. And population studies with wherever there is a cross-sectional study where the particular nutraceutical is in less abundance and more abundance, and what are the health benefits that we get, from which we have to use our imagination and then use the science. Because then only we can find out where the nutraceuticals are really useful and where they can be used. So this is the commonest thing, omega-3 fatty acids. Its sources are fish oil and flaxseed oil. They are rich in omega-3 fatty acids. Benefits, they reduce the triglycerides and have anti-inflammatory effects. And research shows that positive impacts on cardiovascular health. Now, many times a question is asked, now when even the vegetarian sources of EPA, DHA are available, long-chain fatty acids are available, what is the role of flaxseed oil, where we have got short-chain fatty acids? So, this question is usually unanswered, and I usually have to answer that if you use flaxseed oil, and you use a short-chain omega-3 fatty acid, it can prevent short-chain omega-6 fatty acids from getting converted to inflammatory acids. So giving EPA DHA is not going to prevent that pathway. And all oils that we consume has got a ratio of 80:1 of omega-6 to omega-3 fatty acids, and that's why that oil consumption itself can cause a lot of inflammation. So omega-3 fatty acids, which are short-chain, which are in flaxseed oil, or I think in walnut, they are also required. So that is the role of omega-3 fatty acids, short chain. Long chain omega-3 fatty acids, we all know what are their roles in mental health and other cardiometabolic health. So I have luckily found out some cases in practice. So usually in nutraceuticals, we don't discuss about cases or case studies. So here is a patient, 54-year-old, family history of ischemic heart disease, has hypertension, needs 3 drugs to control the hypertension. He has got intermittent palpitations without any reason. So his echo done, ECG done, the electrocardiographic studies are not done, but because there are intermittent palpitations. Thyroid functions are normal. He has got obesity with BMI of 32. He's an occasional smoker, which he doesn't reveal how many cigarettes he smokes, but no alcohol. So investigations were showing high Paxil volume. So he must be smoking more. So that Paxil volume was something around 55. Then HB was 17. So definitely it was polycythemia, and this can cause a lot of thickening of blood. Then CRP was 32, which is extremely high. LPA levels were 40, again moderately high. He has got high homocysteine levels, no flow-mediated dilatation in brachial artery. That is basically the nitrous oxide secretion is judged by the flow-mediated dilatation. So you apply the blood pressure cuff for 5 minutes at systolic pressure and then release it suddenly. Your blood vessels down the line expand more than 10% of their basal. So that is because of the nitrous oxide secreted. But if it is not secreted, that means there is a problem of something blood vessels getting contracted. So low HDL cholesterol, again a risk factor for heart disease. Non-HDL cholesterol is 170, triglycerides are 320. And on full dose of fenofibrate and saroglitazar, still the triglycerides are not coming down. And there are no other drugs which are available for reducing triglycerides, and wants to lose weight. That is the additional thing, and control his metabolism. So what would you do in such cases? So if you look at the omega-3 fatty acids, long chain and short chain together, they reduce inflammation, improve lipid profile. Then they have got anti-arrhythmic effects. There are studies which show omega-3 fatty acids have got anti-arrhythmic effects. It can regulate blood pressure. It can enhance the endothelial function, so nitrous oxide secretion, and reduce platelet aggregation. Now, how much dose is to be given? Because nutraceuticals are usually looked upon as something like a masala. And many companies come out with 58 ingredients in one capsule. So the dose is basically, I call it marketing dose. It is not a physiological dose or even treatment dose. So this is what American Heart Association says, that 1 gram per day for EPA and DHA for consuming for people fish oil who documented coronary heart disease, we require 1 gram per day. For high triglycerides, prescription of omega-3 fatty acids, 2 to 4 grams per day. And then for hypertension and other conditions, again 2 to 4 gram per day. Now the concern is, if the patient is on triple, say, platelet agents, aspirin, clopidogrel, if you give very high dose of omega-3 fatty acids, there are always chances of some bleeding. So usually in these patients, we selected 1 gram per day dose, and then the condition started settling down, and then the weight loss therapy was successful. But because we could control his metabolism. Then fiber, I don't want to talk more on this. We have got soluble and insoluble fiber. Sources are whole grains, fruits, vegetables, and there are various excellent fiber preparations which are available now. Then sources are whole grains, fruits, vegetables, and nowadays we have got like fructooligosaccharides, inulin, erythritol. There are a lot of other fibers are available. And then there are clinical studies which have proven that fiber really helps in controlling dyslipidemia, controlling weight. Then plant sterols and stanols found in fortified foods and supplements. Mechanism is they block cholesterol absorption in the intestines. Benefits are effective lowering of LDL cholesterol levels, and evidence is clinical studies support the cholesterol lowering effects. If anybody is interested, they can read an excellent article on color-based diet. You people must be knowing it, because every color has got a different antioxidant, and these have got different benefits in the body. So something like if you want to tackle something which is related to pelvic organs, you use red foods. If you want to tackle something which is related to pancreas, stomach, gallbladder, liver, you have to use something like yellow foods. Something which is related to heart, you have to use green foods. So color-based diets, and there are excellent articles with evidence is present. Then polyphenols like flavonoids found in berries, tea, and coca. But resveratrol, 150 to 500 milligram is a dose, so not 50 milligram. And benefits are offer antioxidant and anti-inflammatory effects. Then coenzyme Q10. This is again an excellent product which works on an electron transport chain, but which is very rarely used. So sources are available supplements in organ meats. Function is essential for cellular energy production and antioxidant. Benefits are improves endothelial function and may reduce blood pressure. And evidence is clinical trials show promising results in cardiovascular health. Again, I have got a case where I used coenzyme 10 and then got benefits. But because it is costly, I don't know why it is costly, but basically people don't use it, that's why it is costly. So they start using it, it may come down. There is a funny story about glutathione. When we use glutathione as an anti-inflammatory product for fatty liver, it is excellent, it works excellently. And we use glutathione, it is extremely costly. So we have to literally plead with the patient that you take it for 2 months. Once they take it for 2 or 3 months, then once they come back, I say, now you stop glutathione because it is costly. Patient says, no, let us continue that, you reduce other medicines. So why? It gives fairness and glow. So even oral medicines can give rise to that. So patient's perception of cost depends on cosmetic effects rather than metabolic effects. So let us look at this patient. She's a 64-year-old female, case of ischemic heart disease with mild heart failure, then had a history of MI, a myocardial infarction, on 40 milligrams of rosuvastatin and combination of aspirin and clopidogrel. Then was on ARNI, SGLT2 inhibitor, mineralocorticoid receptor antagonist, and beta blockers, all 4 pillars of heart failure. Case of complaints of severe muscle pains and breathlessness and fatigue on moderate exertion. Now we know that statins can cause a lot of muscle pains. So we gave him coenzyme 10, but the dose was 300 to 600 milligrams per day and then reduced it to 300 milligrams per day. So it's statin medication use. Heart conditions, coenzyme 10 is known to give rise to energy benefits to heart, and it can also control migraine headaches. So there are a lot of benefits of coenzyme 10, but again, the dose has to be proper. Then we have got age-related decline in natural coenzyme 10. Even it is given for exercise performance, and it is important to note that these situations include potential benefits from coenzyme 10 supplementation. It's always advised to consult a doctor because, again, it is a very costly drug. So it is 300 to 600 milligrams per day. Then magnesium. Again, nuts, seeds, whole grains are rich in magnesium, helps in regulate blood pressure and improve insulin sensitivity, and studies show positive effects on cardiometabolic health. Again, I have got a case for magnesium. So again, it is a Mrs. RKS, 57-year-old female, postmenopausal, type 2 diabetes on various medications. And all those medications, HbA1c still maintains 7.1. It's not coming to below 7 or 6.5. Then hypertension with diastolic BP remaining around 88. So physicians don't agree that they want it to be around 80. Then on statins, she has osteoporosis, on calcium, vitamin 3 and biphosphonates, but still she has got osteoporosis. Repeatedly, DEXA scans show she is osteoporotic. Attacks of anxiety and subclinical depression is present. She complains of fatigue, loss of appetite, palpitations, tingling numbness in lower extremities, and her magnesium levels are 1.4. So magnesium is useful in controlling hypertension, and I think Dr. Nandita will tell us that in olden days, I think magnesium was given as for preeclampsia and eclampsia conditions because there are no other drug which was safe. Then in type 2 diabetes, magnesium plays a role in insulin action and insulin sensitivity, migraine headaches, and in osteoporosis. Along with calcium, if you give magnesium, the bones can become sturdier and stronger. Then muscle cramps and spasms, again, they can be treated very well with magnesium. So these are the symptoms: fatigue and weakness, irregular heartbeat or palpitations. They can have nausea and vomiting, then numbness, tingling numbness in extremities. This is not always diabetic neuropathy. It can be magnesium deficiency, and it can have mood disturbances also. Then we have got probiotics, sources found in fermented foods and supplements. Gut health, promote healthy gut microbiome. It reduces inflammation and metabolic impact. Again, it has been shown by evidence. So generalized inflammation is associated with disturbed gut flora, and these are the bacilli which are required. Basically, Lactobacillus acidophilus, this improved the lipid metabolism. Then we have got Bifidobacterium, which improves metabolic health, and insulin resistance is again controlled with this. Then Lactobacillus rhamnosus, it controls reduce low-grade inflammation. So it's anti-inflammatory. And then Lactobacillus plantarum, which improves the lipid profile. So there are various effects of bacteria or gut bacteria, but then we have to see what you are selecting as. And usually it is preferred that the local bacteria which are created there. So if something is brought from France, I don't know how much it will be useful here. So usually what I practice, and age-old practice of like starting a curd. So usually use a vegetable or chilies. So you start with first milk, you start with chilies, and then you can have a curd which have got all these bacteria. So you can start curdling and then continue with it, and you can get local bacteria, and then you can have that. But then if we require something like antibiotics, then we require supplementation. Then alpha-lipoic acid, again this is very like favored drug by gynecologists. The sources are available as supplements found in red meat and spinach. Insulin sensitivity is improved. It is antioxidant, and research studies show promising results. Now I want to talk something about antioxidants. We talk of vitamin C, vitamin E as basically antioxidants, but these are all called as extracellular antioxidants. They work outside the cell or endothelium, but there are intracellular antioxidants which are required. So these are basically glutathiones. So if you want to have something like help the cell to heal, we have to give glutathione as an antioxidant for various conditions. Then curcumin, the source is active compound in turmeric, anti-inflammatory, potent anti-inflammatory properties. Endothelial function may improve endothelial function, and evidence, again, there is a lot of evidence is there. Then garlic. Then various forms are available as raw garlic. It can control blood pressure and can control cholesterol. Now we have seen a lot of herbal medicine people use garlic, but they use garlic in a very specific way. They incubate garlic pearls or garlic cloves into curd for 24 hours. So I have seen this, I have used this, and cholesterol and LDL reduction with HDL enhancement can occur with eating garlic around 8 cloves in the morning, 8 cloves in the evening, but that has to be incubated in curd. For 24 hours, it changes its colors to brown. Then you peel it off, saute it with ghee. So I don't know why it is like ghee, but maybe for short chain fatty acids, some colonic effects must be there. And then you use that every day. And if somebody is not tolerating statin, you can use this garlic. Secondly, garlic can be crushed garlic. It has got much better effects than eating raw garlic. So there are some people who eat raw garlic morning and evening and they just smell around, but they don't get much benefits. Then we have got green tea extracts. So again, that EGC is there. And a lot of people claim that I drink tea so that I should get the antioxidant effects. But our regular black tea with milk, with sugar, or with sugar-free doesn't have those benefits. So we have got green tea extracts. And again, coming back to nutraceuticals, because like a French story of vitamin C, 40 years back, one orange used to contain around 350 milligrams of vitamin C. And today, they have to take, if you want to have that much kind of a vitamin C, I think they require 20 to 35 oranges per day. So that's why we require 500 milligrams to 1 gram of vitamin C. Same thing happens with green tea extract. Same thing happens with all other nutraceuticals. They are present in a particular food, but to get that much quantity, you have to eat enormous quantities of that food, which is not possible. So if you want to maintain your good health, we have to go for ready-made concentrated preparations for this. Then vitamin D, we know, again, sun exposure is very poor with, I think, UVA, UVB, all those things with skin, our darker skin, and we don't get enough vitamin D preparations. That's why most of us have got vitamin D deficiency. So we have to take external vitamin D, preferably in a oil form. Nano form is much better, which is delivered and which can be taken. Or if a patient has got severe vitamin D deficiency with high PTH levels, then injectable vitamin D. It can increase insulin sensitivity, it can reduce inflammation, and vitamin D is now considered as a hormone rather than a vitamin. So what practical applications we need? Basically, we need to have a guidelines that incorporate nutraceutical based on individual patient needs and dosages. Because unless we know the dose, that taking what we can say miniature dosages of nutraceuticals will just malign its name. So we don't get benefits of it, and we don't get anything out of it. So we have to have guidelines, and we have to have a quality of production. Again, have you heard of vitamin C in effervescent form? So do you think it is useful? Once we start getting effervescence, water contact, what will happen to vitamin C? Basically, it's not a homework, it's just food for thought. Then dosages, follow evidence-based recommendation dosages, and you need not use masala nutraceuticals. Depending on specific patient's condition, we can use specific micronutrient to treat the condition. So if that is our aim, that I'm going to treat the condition with nutraceutical, then our prescription will change. Then consider potential interactions and contraindications. I will give simple example. A lot of nutraceuticals have got, interactions with drugs. Ayurvedic medicines, they usually give you Jastimad. You must have heard that, Yashtimadhu or Jastimad, which has got a lot of interactions with cardiac medicines. So which can precipitate cardiac failure also. So all the nutraceuticals, we have to look at what are the interactions with drug, what are its pH, how and when it's to be given, whether it can be given with the medicines, whether it has to be separated with medicines. So it requires a lot of studies and mind to when we are writing a nutraceutical prescription. Then provide comprehensive patient education on nutraceutical use, because again the advocacy and education is also extremely important in the field of nutraceuticals. So conclusion, the summary is nutraceuticals offer promising benefits for cardiometabolic health management. Future directions are emerging research continues to explore new applications and new compounds in nutraceuticals. We have to incorporate nutraceutical into patient care. So we have to work as physician and nutritionist working together to design a prescription of a nutraceutical along with a medical prescription. And last thing is, if moderator allows or anybody wants, we can, I don't know how the schedule is prepared, but if any questions, we will be answering it later. So it's all up to Rohit. So I'm very happy that I've finished within the time frame. So 52 seconds are left. Thank you so much for patient listening.
Thank you, Doctor. Wonderful lecture. And I've made some questions.
I'm scared now. Because I know I've seen him for the last so many years and he has got excellent knowledge of this subject. So I am scared.
And I have a complaint this time. You already said everything I had to say in my lecture.
Oh.
So I think the last session is going to be very boring when I am going to present, because they'll say you're just repeating what doctor has already said. But just some clarifications for the audience on, I have 3 or 4 questions, and I'm sure my questions will resonate with most people here. First question is, what are your thoughts on the role of early intervention with nutraceuticals in prevention of metabolic syndrome and any associated complications?
This is basically a practical experience that I follow this dictum that any metabolic syndrome patient comes and patient is not serious. Even patient has gone into a frank diabetic zone, HbA1c hovering around 7, 7.5. I start with diet and nutraceuticals. And there are various nutraceuticals which are present which can control that. Even before starting metformin, we use berry extracts like berberine to control insulin sensitivity. So my personal thought is we should always start with nutraceuticals and then add on to that is medicine rather than going in reverse way.
Thank you, thanks. As you know, the audience is nutritionists and dietitians. So they must find this really interesting and encouraging that you're actually starting your patients first on nutraceuticals and then on pharmaceuticals.
Yeah.
Good. Next question is, how can we integrate products like Wellman, Wellwoman in cardiometabolic issues along with antihypertensives or anti-diabetic drugs?
Yeah. So let me start in the reverse way. Wellman 70 plus, that I have seen excellent results with prostate. So anybody who has got some benign enlargement of prostate or symptoms of prostate, Wellman 70 plus works very well. Then Wellman has got enough nutraceuticals to control inflammation and antioxidant activities. So I don't know exactly whether I will give Wellman 50 plus and 60 plus to that age group, but I usually prescribe Wellman 50 plus to even 60-year-old person. But 70 plus is definitely for any 40-year-old person also if it is having some prostatic problems. And same thing for Wellwoman.
I think it must be more difficult for women because nobody accepts that they are 50 plus. So the third question is, which micronutrient levels in the body serve as markers of inflammation? So what do you actually check? Which micronutrient levels, when you say that they go below a certain level, they are markers of inflammation?
Basically, first thing we check about iron. So in iron studies, we find a lot of people who have got hemoglobin on borderline, but the serum iron is low. Ferritin levels, if they are high, that indicates again inflammation. And other than that, we go for something like a CRP, HSCRP and all those markers.
Okay. And another question about garlic. I mean, I didn't know myself that garlic cloves can be so useful.
Yeah.
And you also clarified the question I had in my mind, but I will ask it anyway because if anyone else has that question, that it just smells terrible. I mean, you know, having 7 cloves in the morning and 7 in the evening would make you like a little garlic.
I will answer with that. Tomorrow you come to my place, I will prepare garlic for you. You eat that and go to your office and let anyone recognize that you have eaten garlic. Because incubating in curd and then sauteing it with ghee will take out all the phenols and it will give only anti-lipidemic properties to that garlic. So nobody will know that you have eaten garlic.
Amazing, amazing. But I'll try that at home first and then in the office maybe. And the last one is you talked about devaluation of food and you gave an example of orange, and I remember that study actually done at Besançon.
Yeah.
And how vitamin C has gone down in orange, but that has happened with every micronutrient in food. So is it right to say, and I just need your comment here, is it right to say that even if you're on the healthiest diet on the planet, you are still bound to be deficient in micronutrients? So you have your macronutrients, the right calories, right carbohydrates, proteins, fats, everything, but you may be still deficient in micronutrients if you don't take a micronutrient supplement.
Now, this may not be agreeable to many because we have got a lot of people who believe in natural foods. So natural foods will give everything. But as that vitamin C study I've heard from you. So I quote it without giving credit to you, but so basically, but I've seen it that most of our foods, they are like, there is something called as genetic dilution. So they are rich in proteins, they are rich in carbs or fats, but they are very deficient in micronutrients. So as you said, everybody should be having some micronutrient for basically maintaining good health.
Thank you, doctor. That's all. I think we have, you have clarified everyone's doubts, and I'm sure these questions would resonate with most of our audience here. Wonderful talking to you. I think we got together after 6 years and you haven't changed. You have only shaved off 10 years of your age.